Go, Bishop.
Greetings, everybody. We'd like to welcome you this evening to the Sourceseeker Hour. And I want you to know that on today, it is going to be hot. I've got some wonderful guests with wonderful wealths of information that they are going to be sharing with you on today. Listen, we want to give a big shout out to the Sourceseeker himself, Baruti Carl Alexander, and we thank him for allowing us to have this opportunity to come to you. On this evening, we're talking about the COVID-19 conspiracies. COVID-19 conspiracies. There's more than one. Many of you have heard of them. And on tonight, our guests are gonna tell us about it. And the conspiracies go down the list. Is COVID-19 really a virus? Is COVID-19 a ploy for genocide? Is COVID-19 something to wipe out the indigent, the poor, and the minority communities? Is COVID-19 a ploy to start us using what we call biometric devices, such as chippings that would give locations and to take away our personal identity and life as we know it? You know, are they trying to put microchips in us to control us? The conspiracies go on and on. Is it really a Chinese virus, as Donald Trump would say? So on this day, I have some very esteemed guests, and I'm going to call their names out, and I'm going to give each one of them a minute to tell you about themselves and what they are doing. On the panel tonight, we have Lady Sabrina Echols-Sampson, Dr. Odili, Lady Cassandra Barnes, Dr. Veon McReyolds, and we have Lady Karen Covey on our panel today. I hope I pronounced that right, Covey Coney. I know you will correct me, but I want to start off with Lady Sabrina Echols-Sampson. Would you tell us about yourself and what you're doing? We're glad to have you on the show.
Thank you so much for inviting me again. This is, I think, about my 4th time being on the show. So I'm so excited. Dr. Sabrina, I'm a medical doctor here in Houston, Texas, and I practice my own butterfly wellness.
Dr. Sampson.
Yeah, that's okay, that's fine. I own a family medicine clinic in Stafford, Texas called Butterfly Wellness Clinic. And I also work in emergency room medicine at Lifesavers Emergency Room, along with my colleague that you're going to meet soon. I invited on the show. And so what I'm excited about, my specialty and what I'm passionate about is prevention. And so I'm really, really focused on preventing healthcare disparities and eliminating racial healthcare disparities among minorities, especially African Americans, that we are seeing are really hard hit, African Americans and Latino. And so I'm going to pass it on to the next person to introduce themselves.
All right, we got another doctor that's on here. And I'm sorry about that, Dr. Sampson. I forgot. I didn't see it on the name, so that's my bad. We have Dr. Odili with us on today. Dr. Odili, would you please tell us something about yourself?
He's muted.
Go.
Okay,
good evening, everybody. My name is Dr. Odili. Thank you for having me. I know this is my first time joining you all for this discussion. I'm a physician of family medicine and urgent care and emergency medicine. I also practice emergency medicine with Dr. Echols-Sampson at Lifesavers Emergency, urgent care at Apex Urgent Care Clinic, as well as a few other places around the Houston area. I've been practicing urgent care and emergency medicine for about 12 years now. I'm also an author of a very poignant topic. The book that I've written is about myths. It's about coronavirus, and I can give more details about that later on. But definitely this is an important topic that we're discussing tonight, because we do need to get the truth out there and help sum it up, save people's lives.
Thank you. We're really blessed to have you all on the show. I also have Lady Cassandra Barnes here. Lady Cassandra Barnes, will you tell us about yourself?
Good evening. It's great to be back on this platform again with, I think all of you I've been with before except Dr. Odili. So it's great to have him to join us. My name is Cassandra Barnes. I am a registered nurse with a master's in psychotherapy. I've been a nurse for 32 years now, and I have a very, very comprehensive background in nursing and mental health management. And so I am excited about this discussion tonight. And I'm looking forward, especially with a panel such as this, minds that are educated and informed. And so I'm greatly looking forward to this discussion tonight.
Oh, right. I'm excited for you to be on here too. Karen, Lady Karen, I hope I'm saying it right. Coney or Covey?
Coney.
Coney. I won't forget it. I am so excited for you being here. Please tell us about yourself.
Yes, I am, again, Karen Coney, and my major was biology. And I've worked with healthcare for about, I guess, 10 years. I was clerical, into the clerical field is the main thing because I didn't finish my biology courses. But I went into the clerical field for 25 years. I have my own tutorial company where I tutor children up to adults to help them in most areas, subject areas. And my heart is children, and I deal mostly with children with autism.
Wow. That is great. I love that. You know something about me, that's my background, dealing with autism and all children with special needs. Last but not least, I got the one and only Dr. Veon McReyolds, who I passionately call Dr. V. Talk to us, Dr. V.
I'm sorry, I can't hear anymore. I don't know if you can hear me, but I'm Veon McReyolds,
Yes.
AKA Dr. V. I run a nonprofit called Trinity Hood. We have basically three wings of that operation. The Trinity Hood, we give free rides out, get people out trying to get them healthy. And then we have Third Ward Bike Shop, where we actually fix your bike so you can ride it to get out and be healthy. And then we have Third Ward Tours, who offers tours in the Third Ward area to get people out and getting healthy. So we're in the business of getting people out, getting them healthy, and educating them about Houston through bicycles.
Oh, wow. I'm loving it. I'm loving it. This is making for a great discussion. Well, Dr. Echols-Sampson, I want you to go ahead and get us started. What is it that you feel most importantly that we should know? The conspiracy theories are out there, the 5G, or this is a virus that's only targeting certain minorities, because there was even something that came out where there was nurses saying that it was a disease that was meant to attack the respiratory systems of Asian men and then other minorities such as Black. What is it that we should be worried about? What's really going on?
Yes. I've heard many conspiracy theories about this being, number one, a hoax. That's probably what I hear more than anything, is that this is really not real. And that might be why you're seeing people fight against wearing their masks in other places, because if this has not happened to anyone that they know or someone in their close inner circle, their family, then people are so rebellious and resistant, you know, about doing the preventive things to prevent the spread. So the hoax one, and I've even had patients who tested positive for COVID-19 with no symptoms. Asymptomatic.
Wow.
They don't believe they actually have it, and many times they come back in a week or two and say, I want another test, because now we're doing a rapid nasal swab. And when you tell them you don't have symptoms, but if you develop symptoms, let us know, they will come back. They were like, I don't believe I had this. I don't believe this at all. And so COVID-19 is a virus we first heard of out of Wuhan, China. And the World Health Organization declared a pandemic in March of this year. So since March of this year, we have been what I would call on a lockdown as far as really following this virus. But the virus was out in 2019. That's why they call it COVID-19, is because this is a novel virus. A novel virus is a new virus. And supposedly was supposed to only be in bats and wild animals. And somehow it has jumped from an animal to a human being. So that's where a lot of people have these conspiracies. This was injected in somebody, this was doing this was that, which I don't have that information of how this actually jumped into a human being. But what I do know is that I have treated real people with and I've sent people to the hospital, breathe and needed oxygen. And I attended a funeral last week of a close friend whose husband died at the VA 2 weeks ago of COVID-19. So this is real. A hoax. Seen this wipe out families. Gone from coronavirus. So I'll yield it over to Dr. Odili, and maybe he could tell you a little bit more myths that he has to overcome. But that's probably one of the biggest one for me is that it's not really, if it's not affecting them and they don't feel symptoms, it's not real.
Well, what I'm gonna do, I'll probably let y'all tag team for like a minute or two, because I want to put some more salt in the game, as we say. And that is a couple of weeks ago, there was a doctor that came out and did a public platform being supported by other doctors, where she said that this whole thing could be cleared up with, and y'all got to help me pronounce it, the malaria medication, hydrochloroquine, something like that, and what we call, I believe, zithromycin, or the Z-Pack. And she said that everybody that she treated came out A-OK. So I got my two doctors, Dr. Odili, Dr. Sampson here, and you can add how you feel about it, but what's really going on with that? Is that, in your medical opinion, does that make sense? Is it true, or is there something else?
So I've taken hydroxychloroquine many, many years ago during a family trip to Nigeria. I contracted malaria, and that was what they used to treat me. So I have firsthand experience with the medication and family experience as well. And based on the research that we've been reading, we are not seeing any significant evidence that says that hydroxychloroquine is the cure for people's COVID-19 illnesses. Now, the doctor that you mentioned that came on TV and made her spiel, we should note that on record, the clinic where she works is a pediatric clinic on record. Now, we all know that the virus has roughly a 1% mortality rate. So that means that roughly 1% of the people who contract the virus will not survive, 99% will. But for me and you, the only number that matters is, do I live or do I not live? So the numbers say 99%, but nobody can predict who's going to be that 1%. Now, when she says that she's treated 350 some patients and all of them went home, when you work in a clinic that does not have the ability to keep people, to admit them to the hospital, everybody goes home. When you visit your pediatrician, everybody goes home. Nobody stays. When you go to your family care doctor, everybody goes home at the end of that. So she can say that everybody goes home, but that's because everybody goes home. That's not the same thing as saying everybody's doing well. Everybody's symptoms have resolved fully. Nobody was hospitalized. So you can say something and have it be true, yet it cannot be the whole story. So without the hard data, the raw data behind the actual patients that she's treated, what symptoms they suffered and how they were on follow-up, it's hard to really say exactly what the truth is. But we already know that she has a very good chance of all her patients doing well, because we already know that 99% of patients are going to do well. Our goal is to help people feel better in general, because surviving and thriving are two different things. Now, we see patients all the time who have respiratory distress. They have long-term loss of smell. They have long-term fatigue and weakness after the virus that lasts several weeks and months. So you can have the virus, you can survive the virus, but you may not thrive afterwards for some time. And if we can keep people from getting the virus altogether, we can reduce those risks.
Wow. Let me say this, and then I got somebody I want to bring in here. Doctors, should I feel good about 1%? Because even though I know the stat says 1%, that 1% is a whole lot of people, because everybody knows somebody personally that's died from this disease. And in some families, it's family members. So when we're talking 1%, some people talk, well, hey, maybe that's 15, 20, or 30 people. But in Wuhan, China, where bodies were everywhere, in New York and these other cities where they were actually using trailers and 18-wheelers as makeshift morgues. 1%, even though 1% is 1%, that's not a good 1%, is it?
No, it's not. No, it's not. I mean, I'm in agreement that this is definitely a disease. This is a killer virus. This is a killer virus. And many people don't know that when it attacks your respiratory system, it also, for those that have severe diseases in the hospital, maybe on the ventilator, it sets off an inflammatory process in your body. That means it's called a cytokine. It's called a cytokine storm. And so not only does it attack your lungs and you can't breathe, but your own immune system is fighting so hard that it causes a storm to go off in your body. Because a storm is going on in your body, that's why you're hearing about the deaths. Because it may not be the coronavirus caused them to die. It may be the storm that is happening, where now your kidney starts to shut down. Now it's affecting your heart, or maybe you become, but your own immune system is fighting so hard against it that it can cause death even to someone that is healthy. And that is what many people are not aware of. And so even if one person died, that's one too many. That's one too many, and really touched my heart was overwhelmed even when I heard about the kid in Georgia, I believe, that died. There was a young kid that died. So that's a life that's lost, that didn't have a chance, to grow up and live out their God-given abilities. And so if one person dies, too many, and that's why you heard Dr. Odili is saying is we're really trying to prevent people from getting this because we don't know who is going to have a bad storm. You know, I have a really good friend now. She's in Texas City and she's in the hospital. She's not on the ventilator, but she was treated out. She was positive a week ago. She got worse. She went back to the hospital. She's been in the emergency room twice. They finally admitted her. Her oxygen was low, and now she has infection even in her blood. So infection can go into your blood and cause sepsis. So this is very, very serious, very serious. And the reason why people like African Americans, Latino, if they have diabetes, they have high blood pressure, heart disease, smoke cigarettes, COPD, asthma, their immune system is compromised, HIV. So anybody that has a lower immune system, they could die from this because their immune system is not strong enough to fight it off.
Thank you so much. I'm gonna bring in Dr. V. Dr. V, what do you say to all of this?
Yeah, you know, one of the major issues that you don't hear about a lot, and it's part of the conspiracy theory that the real cause of COVID, if we really look at it, will be climate change. Because now what we've done, we've destroyed the animal habitat and start pushing people closer and closer and closer to the animal habitats, and then people are closer together. So when we stress the animals and we stress the human beings, then these viruses have an opportunity to really thrive. And that's what we're seeing now, is that with the climate change, that you will get more of this stuff. This is just the first one, that the climate scientists have told us that these things are going to occur. And now we see them coming to fruition, but no one is really talking about the things that we need to do to change, our way of living. And that's what caused it. And I want to just chime in on what Dr. Echols was saying, particularly about those people with compromised immune systems, that many of the particularly minority and poor people, immune systems are compromised, particularly Black folks, is from environmental racism and just generally systemic racism. That we're put in areas where we don't have proper, first of all, education, so that we can navigate our lives well. And then we don't have good health care. We don't have the money to afford health care. We're educated to consume, what Billy D told us, get that code 45. We're educated to really not take care of ourselves, that we eat. We say, oh yeah, that's soul food. Soul food will take away your soul. I rest my case.
Wow. Lady Karen Coney, I want you to chime in on this and tell us what you're feeling about this, and what do you think? What is the real conspiracy that's going on here? We heard Dr. V say that it's more environmental than anything with climate changes. We heard our two medical doctors that gave us a really great expose on the history and the evolution of this COVID-19, or this alleged COVID-19. What do you say to that, Lady Karen Coney? Where did your mind take you on this?
Well, I thought mainly about radiation. I do believe it's environmental, and
okay.
But I have a hunch, for some reason, that I feel like this was something intentionally released. I don't believe it was an accident. That's from all that I have studied and from the various scientists who have spoken, that this was not accidental. And I studied radiation for about 4 years, and a lot of the effects that some of these people are going through reminds me of the study that I did with radiation. I don't have proof, but from the study and from all the books that I have here about radiation, which I have been studying with the 5G and all that, I have no idea. But with what I have studied, it does seem to have a correlation to me with some of the effects that it's causing on people, especially the fact that it's affecting the respiratory system. Because if you study radiation and the radiation effect when it's too much in society, it can in fact affect the respiratory system, which in terms will shut down the many body systems, you know. And I have a lot of friends who work in healthcare, and a lot of them feel the same way. Even though we know the virus is real, we do believe that a lot of it, it could be resolved, you know, just like, unfortunately, you know, when Trump found out about it, he took his time about, you know, making certain changes, and he took his time. He still is. He's not suggesting the mask, and he's okay with not practicing social distancing. You know, this is an election year. So it's a lot of things that I do believe play a part. I do not believe this was by accident. I do not believe that this was just something that just happened in the atmosphere. I believe someone was actually behind this. And
hold up, Lady Coney. Lady Coney, are you suggesting that this is a form of biological warfare?
exactly, 100%.
Wow. Wow.
I
Okay.
just don't
Okay.
think you'll
That's
create a
definitely.
weapon that'll kill yourself, though. That just doesn't make sense.
Huh?
Generally, people don't make weapons that'll kill themselves. They have weapons that they can control. This is a weapon that you can't control. It would be like I'll put out a gas all over Houston and, you know, just not randomly kill people, but if I did that, I'd kill myself, my friends, and other people. I couldn't direct it. And we can see that this thing is not directed because not only are just normal and mostly poor people, but we can see people on the higher echelons. You know, several country leaders have got this. So if it was an intentional thing, it was, you know, maybe Trump might have done that. You know, that's the only person that I know. That
Dr. McReyolds, though, Dr. V, like Lady Coney said, that I'm gonna bring Cassandra in. Could this have been an experiment that went out of control?
Yes,
because
that's what
I've heard many experts say that the actual virus originated out of the United States. And then it was sent. I mean, I don't know if people keep up with that. We have Harvard students and a professor that are under arrest right now because they were caught going to Asia with vials of samples of the virus. And that was months ago. So do you think that it could have got out of control?
Coronaviruses, but probably not the COVID-19 virus. There are many, many coronaviruses, but only one COVID-19. And so when you see the patents on, you know, the treatment and that sort of stuff, it's for other coronaviruses.
Okay, I know the doctors are gonna have a time with us. Cassandra Barnes, come on in here, Cassandra. Tell us what's really going on.
Okay, well, first, I'm very opinionated as it relates to this virus, and I do believe, as Karen Coney has stated, that this is biological warfare. I said that from the very beginning. I have been a registered nurse for over 30 years, and I understand. I've worked many viruses, dealt with patients with various viruses, and the way that this virus behaves is very, very different. You normally are not going to have a virus that kills its host within 2 and 3 days. Even in an infection, even when I worked HIV/AIDS, when it first kind of hit the scene in the late 80s, when we didn't know anything about it, you may go from HIV positive to death, especially being African American, in about a 6-month period of time back then. I mean, because I used to work HIV/AIDS, and they were dying, Black men in particular were dying very, very quickly. But even then, it wasn't 2 and 3 days. I know of a woman maybe 3 weeks ago who was tested that Wednesday, and she barely had any symptoms. She was tested on Wednesday. She made a post on Wednesday stating that she was being tested, and what should she do if she's not sick enough to go to the emergency room. Literally Friday, she was dead. This is 3 days later. She died. Viruses don't behave like that. They don't take over your body and kill you. You think of the man of God, Pastor Manson was it Manson Johnson that died? Yeah. Okay. He was preaching in his pulpit a week before he died. Viruses don't behave like that.
No, it doesn't.
I listened to, and I tried to go back and listen, but they've taken it down. The documentary that Dr. Judith Mikovits released at around the beginning of this outbreak. She literally worked with this industry, with this virus, and she even linked Fauci and several other physicians to creating a virus that was designed to be released, to release a pandemic. Because I could go into a lot of different trails related to this. When you look at Bill Gates's connection, somebody that is not in healthcare, is not a healthcare professional, but he's overly invested in how the world would respond to a pandemic. Mind you, he owns or is heavily invested in pretty much all of the major companies that's doing the development of the vaccines, that's dealing with the research. He's financially invested in all of that. I do believe that they intentionally released this virus. Even this particular Dr. Mikovits said it would literally take over 100 years for a virus that is primarily in animals to mutate to the degree that it can survive in humans. She stated that in her documentary. They've taken it down. They literally arrested this woman behind things that she was saying and things that she was putting out before this COVID-19 strain, as Dr. McReyolds mentioned, of this coronavirus came out. She was blowing the whistle on this practice years ago. So this is not, when you have first of all, if you know anything about the development of vaccines, you have to have people that have contracted the vaccine to develop the antigens that we have to use to develop the vaccine. You have to have it infected, and you have to have people infected with it to be able to draw their blood, to be able to contract the antigens that you need to develop. So you have to have people. I think it did get out of hand. I think it was targeted toward Wuhan, China, which China is known to try to control their population growth. Mm-hmm. You look at the physician that died in China that was blowing the whistle. That's and he came up dead. He was in Wuhan. He was the one that was stating that this is something different. He didn't know what it was. And then all of a sudden he contracts it and he's dead. So it's very clear that this is a conspiracy. It's not a matter of them releasing something that won't kill them. They, as far as we know, they can already have a vaccine. that we don't know about that
That's
they've
right.
already taken? Why did even when it was audio was leaked, and I don't know if it was a real audio or not, where Vice President Pence was stating that they already had the vaccine, so they didn't need to be worried about it.
That's
Okay,
right.
I don't
Yeah.
know if that was real or not, but I know Donald Trump, who is as narcissistic of a personality, and he's as narcissistic as Satan was, really. If you think about how Satan's personality was when he was trying to be as God, Donald Trump is as narcissistic as Satan. And you're gonna put yourself at risk to contract the virus. So I personally think they do have a a vaccine that is created, that they have taken, but they want to have enough people infected so that they can be able to draw their blood, develop their vaccine. This is a multi-billion-dollar or multi-trillion-dollar potential industry. They're narcissistic, okay, and they don't care about 1%. Trump said it himself. Look at, well, we may lose some people. He don't care because we're not going to lose his family members. They don't
That's
care
right.
about the 1%. If you have the population of America, it's over 70 million. I don't know the exact number. 1% of 70 million is a whole lot of people, but
Yeah.
they don't care about that. If you take 1%, that may not seem like a lot, but when you put it in the bigger range, 1% of 70 million, then now you dealing with, so someone said there's 399 million people in the United States. 1% of that is well over, well over a million people for sure. So over 3 million people, right? Almost 4 million people. So that's going to be all of our family members, not to mention all of the gobs of people that I already know personally. My aunt died from coronavirus. One of my very good friends died from coronavirus. So it is absolutely a conspiracy. And this woman, Dr. Makovich, was blowing the whistle on it. And if she perished, she was going to perish, but she even raised the issue, what does Bill Gates have to do with all of this related to healthcare? When he's not a healthcare person, he's a technology person, because they stand to make trillions of dollars you think about putting a vaccine all over the world, how much money? They're narcissistic. It's not about the money for them. It's about the power, the control. It's about all of that. So I do believe that this thing is absolutely a conspiracy that was released. I do think it got out of control. I do think that. But I almost know for a fact it was intentionally released. It's definitely biochemical warfare. That's for sure.
Okay,
Brother George.
And I know some of y'all other ones want to get in here real quick. I do want to introduce that we have another guest that has come on. Karen, I know you want to get back in this too, and I know that the doctors have a rebuttal for us. I know this is a very hot topic, so I know everybody got a lot to say, but I do want to get him in the conversation too. I'm talking about Pastor Chris Times. Y'all give me a minute to let him introduce himself and any statement, Pastor Times, that you would like to make concerning our topic. I know you've been listening, and our subject is the COVID-19 conspiracy. Is it really a conspiracy? What's really going on? What's true? What's false? What's fake? What's facts? So, Pastor Time, I'm going to go ahead and shoot you in here while it's hot. The gun barrel is hot, it's smoking, so get on in here and tell us something.
Yeah, I believe that it's a conspiracy, and I'll just back it up to all the other times that the United States have developed biowarfare.
Yes.
And it's sad because, you know, we go all the way back to the Tuskegee experiment. You can go back to smallpox with the Indian, you know, the
That's
Native
right.
Americans. You come forward and talk about all the other types of behaviors that this country has done to experiment on people. I personally believe, and I don't have any facts to support it, but I believe that even some of your worst viruses have come probably from labs developed by universities here in the United States.
I believe it.
And so, you know, look, and this is kind of strange, but I'm gonna throw it in there anyway. Conspiracy, George H.W. Bush, you know, he said that if you want to know about anything that's going on, watch the movies. He said
Watch
that
the
from the
what?
White, watch the movies. And he said that from the White House, from the Oval Office. And so, you know, you look at what's going on. They had that World War Z zombie movie years ago about this pandemic. And you got lots of other movies about pandemics. As a matter of fact, since you look at, if you look at Netflix, they're now, you know, loading up pandemic movies over and over again, different types of one, outbreak and all kinds of stuff. But I think it's to prepare us for this quote unquote new normal, this extinction event that's going on. My dad told me years ago, back in the 80s, that he believed that even AIDS was a genetically modified bio disease, that, you know, bio virus that they put out in Africa, you know. And, you know, the thing was that it came from monkeys to humans. So it's the same type of, I think, lie that they're saying about this one, the COVID-19, that it came from something and jumped into, you know, humans. But it is acting strange. I got some doctors in my family. One of them actually works at the CDC, and you know, so things are strange and they're not normal, and this thing is moving in ways that's not normal. It's killing people in all kinds of ways. They said it didn't affect children. It absolutely does, in different types of ways. It's neurological. It does all kinds of things. So it clots up your lungs and everything else. It's a horrible thing. As a matter of fact, they're finding people having strokes after they're quote unquote released from the hospital, and 30 days later, folk are having, they're saying they're relapsing on it, and they're catching it again, which probably is a lie. They probably never did get rid of it, you know? And so it's attacking other parts of the body, and it's terrifying doctors. So that's my take on it.
Well, check this out. Real quick, I know Lady Karen wanted to give a rebuttal, and then I got to bring my two MDs back in here so that they can kind of navigate what we have said, because as you can see, we have some very, 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 I'm just going to say we got some opinions on here. And I do want to get a feel from my medical doctors how they feel about what the majority of folks on here are saying. So, Karen, come on in here and talk to us real quick.
Okay, well, I want you all to notice. Remember during John Lewis's funeral? What did they do to the podium after each speaker? Who remembers?
They sanitized, wiped it off or something.
Why? Does anyone know why? Can I get a doctor to tell me? I can't hear. I can't hear.
Dr. Odili.
So we know the viral particles can be spread through coughing, talking, etc.
Is that fact?
Yes.
Okay, so tell me why every time Donald Trump, Dr. Birx, Dr. Fauci, and his team, they spoke at the same podium, same mic. They touched, they leaned on the mic, on the podium. None of them wore masks. But yet they felt like they were protected from it. It is impossible if we know what we know, and they are supposed to be top line doctors, correct? Okay,
So
so
they'll tell
why?
you that they test every day. So they'll tell you that, oh, I'm negative today.
Yeah, but they're negative today, but they don't know. But what they're telling us is to wear masks, correct?
But they test every day.
But either way it goes, they're still telling us to wear masks. I have a child who tested. The first time she tested, okay, she tested positive. No symptoms, none whatsoever. But she had been contacted that she had been exposed from another team. She plays basketball. She was told that she had been exposed. So when she went to go get tested, absolutely no symptoms. The test came back positive. Okay, a month later, she went back. The test says positive. Okay, I have so many friends. I have people in the medical field who have had absolutely no symptoms, but yet they have tested positive. So if they're preaching one thing on the national stand and they're not practicing it, everybody's going to wonder in their mind, okay, so if they're not practicing and they're using the same mic, they're not wiping it down, something's got to be going on here. Some kind of truth is not done, or either they've been vaccinated against this and while they're letting other people die. So it's so many conspiracy theories out there. That's got to be proven. Why is that? And now all of a sudden they want to wear a mask once the word gets out that people are questioning and asking, okay, so are they also involved? So they're leaving the door open for all of these conspiracy theories to be brought forward. Even if it's not true, they're allowing this to be opened up.
Dr. Sampson, Dr. Odili, what you got to say to that?
So we know the White House puts out the messages that they want their people to believe. So everything that comes from that podium, you have to take with a grain of salt. They test every day so the president feels safe. The president doesn't believe in masks, so you can't really take a lot. So when you have an uneducated person who doesn't read and doesn't believe scientists telling you his opinion, that's what it is. It's the opinion of somebody who doesn't read, is not educated well, and does not believe in scientists. So the lines of thinking coming from the podium at the White House are not that relevant to me. I do see that it's a confusing picture for someone to watch and see it done one way and see it done another way in different settings. But all doctors, all scientists are skeptics. We're all skeptics by nature because we want things to be proven too. We don't believe what other people say. We have to read it for ourselves, or we have to see it for ourselves in patients. So, you know, I've probably seen 1,000 patients with COVID over this time. A lot of them don't have symptoms, and that's not surprising to me. People test positive for the flu and sometimes don't have symptoms. People test positive for pregnancy and sometimes don't have symptoms. So the day you see them and whether or not they have symptoms has nothing to do with whether or not you should believe the test. The validity of the test is proven before you use the test. You don't decide if you're going to believe the test after you use the test. You have to decide before. Otherwise, you don't use the test. If you don't think a test is valid, if you don't think a test is accurate, if you don't think the test is worth a damn, you don't use it. You just don't use it. So you don't get to decide after the fact, oh, I'm not going to believe this test. Or you wouldn't have used it in the first place.
No, of course.
Definitely, it's fine to have a healthy dose of skepticism. We're all skeptics, but we have to lean on the evidence that's before us. So when you want to have discussions about what you're seeing, you definitely believe your eyes, but know that it's a complex virus. It manifests differently in different people. As far as whether or not it was made in China, we don't know. Maybe it was. That's a separate issue from how are we going to deal with it here in America. It's here now. Where it came from matters a little less because there's 1,000 people dying a day. So we still have to figure out how to save those 1,000 people best as we can. Is there a vaccine somewhere else in the world? I mean, if China had a vaccine, would they really shut down their whole economy? I mean, people were dying in the streets there too. But again, that's a separate issue. Maybe they do have one, maybe they don't. If they do, we'll know, because guess what? They're going to sell it. So if they have one, they're going to start selling it, and we'll know the answer to that question within a year's time. But the long story short is we still have a problem here in this country that people don't believe is true. And if you don't believe it's true and you die, like Mr. Herman Cain, who's the better person there?
Wow. Doctor, both of you, I'm hearing what you're saying. What happened in New Zealand? Because I know y'all been seeing New Zealand on the news. What happened in New Zealand that's not happening here? If y'all know, because New Zealand is.
Oh yeah, I know, because I had a trip to New Zealand planned. What happened in New Zealand is they shut everybody out. Nobody, unless you were from New Zealand, was allowed to come in. And if you come in, you had to sit your butt down for 14 days and get tested when they had tests arrive. America is too fluid in its travel, so that was never an option for us. These smaller countries are more able to control their borders. New Zealand is a small country. They control their border. That pretty much sums it up. But what you're going to see in the next 6 months is you're going to see the virus eventually make its way to New Zealand. And because those people have not suffered the virus, they're going to be ripe for the picking. The virus is going to spread. There's no place on the planet that's going to be fully protected from the virus. Everywhere is going to suffer their own pandemic in their own time.
Wow. Dr. Echols, what you got to add to that?
Yeah, I agree. When you look at the research here in the United States of America, one of the reasons why New York was hit so hard, one of the biggest cities in our country, is because of not because of an influx from China, was actually an influx of travelers, international travelers from Europe, Italy. So our borders were not, even though when we were, I remember watching on the news, like I've never seen anything like this, when they were reporting 800 people died in a day in Italy. Then the next day, 700 people died. I'm like, what? I've never heard of anything like this. But those people were still had authority, were authorized to travel internationally from Europe, or people who had traveled to Italy. Now maybe they were in France, or they were in London. Now they travel to the United States. And so the majority of people that spread the virus here in the United States, when it was an international travel, came from Europe and not from China. You know, the virus started in China, the outbreak started in China, but by the time it hit the United States, because our borders were still open to international travels, I believe that if we would have shut our borders down faster, if we had a national mandate, everybody wear masks, like in Korea. We do have models like in South Korea where they're able to track the virus, they're able to isolate people, they're able to jump on things right away. And many have questioned, why haven't our leadership, why haven't our president issued a federal act to make more masks, make more PPEs, make more ventilators, you know, supply us everything that we need to shut this virus down. And so we continue to have international travels. Now, not only do we have international travel, but we have community spread now. We have community spread. I'm speaking of the beginning of the pandemic back in March. So once you start having community spread, now it turns away from looking at those that are coming from the international travel. Now we're looking at who is in your community that's high risk and that's spreading the virus.
Right.
And so what we found is that people that are asymptomatic and don't have any symptoms and don't want to wear a mask are really super spreaders, and they could be spreading that virus. So when you saw those pictures in March, those were real. Those pictures of people being on a beach. They went to on cruises. They were on spring break. That's how that virus was starting to spread around. They would come back, see their parents, their grandparents, and they spread it now in the community. Now we have community spread. And that's why it's been so challenging to shut this virus down, is because in different parts of when it was high in New York, it was low in Texas. We only had maybe minimum 20 deaths, you know, and New York had at the time 10,000 deaths. And so we didn't think it was going to hit us like it's hit us in Texas. But now in Texas, our infection rate is still high. I think they told us it was 20% or something. And it's low in Nebraska and Utah. But soon, like Dr. Odili say, you're going to see those numbers go up like they did in Arizona, in other states, because people are still traveling. I have put people on quarantine. They have taken themselves off quarantine because they say, I feel better. I'm okay. I want to go back to work. If I don't go back to work, I don't get paid. And so you have all these different situations where people feel better, and many times they still have the virus and they should not be going back to work. I have put people in quarantine that work at the grocery store. And that's why I recommend people do curbside. Don't go into the stores if you don't have to. Don't go into restaurants right now unless you have to. Order curbside. Pick up your phone and call and make an order, because these people are infected. So I don't spend a lot of energy time on conspiracies. A lot of my energy has to go with stopping the spread of this killer virus. And one of the things I wanted to address what Cassandra said was, how could a virus kill someone this quick? This is exactly what I'm telling you about this inflammatory process that goes on in the body, the cytokine system. You can't see it. The reason why you see somebody, if you hear somebody died within days of being tested, they already had the virus. The virus, they just did not display symptoms at the time. If somebody goes in the hospital and their oxygen is 70% and it's supposed to be at 100, and now they're requiring oxygen, this is a silent killer. We have seen people with an oxygen level of 70, even 60, sitting up like this with their phone talking to you. How could somebody with an oxygen level at 60 and 70% be talking to you looking at their phone? And it's not until that oxygen level hit a low for them and that immune system kick in trying to fight this virus that they begin to need oxygen and a ventilator. This is a silent killer. You can have pneumonia and not even know it. A silent pneumonia, I call it COVID pneumonia. I call it silent pneumonia. I've had a patient, she said, oh, doc, this is not COVID. I go, all I got is allergies. I'm good. She said, all I got is a sinus infection. I said, let me evaluate you. We're in the ER. She ended up having COVID pneumonia. She didn't need hospitalization. Her oxygen was good, but she was in shock that she had COVID pneumonia. This pneumonia will sneak up on you and you think all is good. You walking down the street. You're fine. You're not even short of breath. And then just like that, it attacks your airway and you can't breathe. You cannot breathe. And so that is what, when Cassandra say, how could somebody be doing good one day and then in 3 days later dead? Because this, and they're doing more research, your immune system is a storm going on in your body. And some people cannot handle it. And that's when you're hearing about, oh, they had it, they just got diagnosed, now they did. No, they've been had it. They had it more than those 3 days.
Mm.
That's been my experience. That's been my experience.
Wow.
Yeah.
Thank you, Dr. Echols. That's very enlightening. Before I was gonna bring Nurse Barnes back in, but I was trying to see if Dr. V is back. Dr. V, are you back?
Yes, sir, I'm back. I didn't get to hear a lot of stuff that was for a while, but one of the problems particularly is that our society does not provide us with good factual information, that we get so much misinformation that it becomes difficult to tell what is true and what is fact. And then we start to make up stuff and say, well, if it was this, then that. And we go out on, really misinformation. So it's really the society that we live in that's causing us to have these problems. But like Dr. Odili said, we need to deal, we can see us here now. That's what we need to deal with, is protecting ourselves from the virus. And I suggest.
Did we lose it?
I don't know. Oh. That's a mask I haven't seen before.
Wow.
Okay, I'll jump on in. Well, first, let me be very, very clear. I work for the largest healthcare management company literally in the world, and we're at the forefront of the coronavirus management stuff, all of that. We get briefed several times a week on where they are. And one thing that is very clear with my company as it relates to misinformation is there are no experts related to coronavirus. This virus is too new. Everybody is learning. Everybody is studying. We live in an age where we hunger for information, and CNN and other outlets are reporting on it 24/7. So they're just giving you conjecture. You have experts in epidemiology, you have experts in infectious disease, you have experts in all of the disciplines, but there are no experts in coronavirus at this time. So you're going to have changing information as they continue to do research, as they continue to study, as they continue to do these things. So we, being the largest healthcare management organization, understand that there are no experts. So it's nothing that anybody is telling you at this point that is absolutely concrete. Everything is being studied. You're dealing with a virus that's technically 6 to 7, maybe 8 months old at the most. So they're not gonna have concrete information that they can disseminate. This is why you've heard them say, well, once you get it, you have lifetime immunity. Now we know that's not true, because people that were cleared, as Ms. Coney stated, or somebody stated that they didn't feel like they had cleared the virus in the first place. They actually had cleared the virus. In some cases, they were testing negative, and now they're testing positive again. So we just absolutely don't know. They are learning, they're studying, even as it relates to the length of time that the virus lives on hard surfaces has changed from what they originally stated. Things that they stated as it relates to transmission, even the impact on the body is changing to where people now are having their circulation shut down to the degree that their feet and things of that nature are shutting down. They're developing wounds that they're calling COVID feet and COVID wounds. And so no, you're not going to have concrete information on a virus that is 7 months old. It's just not going to happen. So we're learning, and as they're learning, everybody's putting their opinions in, and because they're physicians or healthcare personnel, everybody's taking that as the Bible when there are no experts. They remind us of that pretty frequently. The other thing that I would say as it relates to testing, which is very puzzling to me, and this has happened to more than one person that I know, to where they showed up to be tested. I guess they filled out whatever needs to be filled out, but then they had to wait so long to get the swab that they left. And then they received a phone call to say that their results were positive when they were never even actually tested. I know somebody that happened to in Dallas, and I know somebody that has happened to here. That is now, being a healthcare professional, I do understand how that mix up can happen, because I've seen so much in 32 years, it would literally blow your mind, the lack of integrity that I've seen in the healthcare industry across the board. From wrong surgeries, wrong body parts being amputated, and all kind of craziness that you can't even fathom. But that's why I don't trust the data. I don't think it's a matter of what country it originated in as it relates to the conspiracy theory, which is the topic for tonight. But I do think it matters that it is a conspiracy. From wherever it came from, wherever it's going, whatever it's doing, whatever the motive is, it is a conspiracy. But I do agree with Dr. Odili, is whatever it is and wherever it came from, we have to do what we can to manage it for ourselves. But when Dr. McReyolds stated that the information is always changing, that is going to be the case until enough time has passed to where we have some actual real information over a significant amount of time, you know, to have some concrete. In the meantime, you're getting educated guesses, for lack of a better word. And this is why you have so many different opinions, because you just don't have the data right now. And that data is years out, unfortunately. It's not gonna happen right away that you're gonna have concrete data. You study epidemiology over a length of time, not 6 months and 8 months. It just doesn't work. Look at HIV/AIDS, look at, you know, all of the other viruses that we've had to deal with and continue with. Look at how long all of that has taken. You know, when I was coming out of nursing school was when we were first hearing about HIV/AIDS. We didn't know anything about it. And I was on the front end of all of that, and it changed. It almost doesn't look at all like what we thought it looked like back in the 80s and the 90s. You know, so you just have to take it as a grain of salt, what you hear. The main thing is protect yourself. You know, whatever the information is, it will kill you. That's the bottom line. The virus will kill you. So whatever the dynamic is almost irrelevant. We have to protect ourselves. That's the bottom line. With that massive mask that you have, that I've never even seen that before.
Oh Lord. Oh my. Listen, look guys, what I'm gonna do is I'm gonna get final thoughts from everyone, starting with Pastor Chris Times. I ran out of time, but I'm going to ask all of you publicly if you would be willing to come back for a part 2. It'll be my turn to host the show again, like in a week, and I want to get everybody back, and we want to go. One would like to do. Would you like to come back and do this again, part 2?
Oh, yeah.
Great. Listen.
Yes.
Well,
Yeah.
oh, wow. I'm excited. Well, what I'm going to do is I'm going to let everybody have final remarks. The first person that I'm going to call up is Pastor Chris Times.
Yes, you know, initially thought that this was some kind of reckoning. This virus, it really seemed biblical in proportion, but I do believe that it's an evil thing, that everybody should gird up their loins, so to speak, protect themselves, remain faithful, prayer, protect yourself. Yeah, it can attack anybody. And this is one of those things that is really indiscriminate the way it works. So, you know, I'm a man of faith, a person of faith, so I stay prayed up. You know, I know science goes so far, and there are lots of scientists, medical doctors in my family, several of them, but we're all people of faith. And that's where I kind of land on this. And you know, I don't tempt God, so I don't go out and hang around a bunch of people without a mask on, something like that. But I just try to remain faithful, and that's kind of the way I approach this whole thing.
All right. I want to, and I'm giving everybody like a minute to a minute and a half to express themselves. I'm going to ask Lady Karen Coney give us some final words.
First of all, I want to say I really appreciate and the opportunity to be a part of the forum tonight, and I look forward to coming back. And my last words are that, yes, I believe it's real. The virus is real. I do believe it is a conspiracy. And as Pastor Chris said, I am a woman of faith. And I believe that we're supposed to take every measure to protect ourselves and our family that's recommended by the scientists, because I definitely believe in scientists with a biology as my major. Not quite finished, I need to go back. But I do believe it's an evil attack. But what inspires me is that, being that I'm a woman of faith, you know, I just quote scriptures, you know, no weapon that is formed against me shall prosper. And then I do, you know, study to show thyself approved unto God, a workman that needeth not to be ashamed, rightly dividing the word. I believe God is the major scientist, and he is the major scientist. If nothing on this earth that God doesn't know about. And so that inspires me, that encourages me. I refuse to live in fear. I refuse to walk in fear, but I do believe in walking in wisdom. Don't be ignorant, you know, like so many people are being ignorant, in my opinion, you know, including some pastors, you know, where it's okay to gather with all the multiple people in one room, not experiencing 6 foot distancing, and etc., you know, that the scientists recommend. I think that's foolishness, you know, and I do believe what Dr. Sabrina said, Dr. Sampson said, is that no matter where it came from, we need to realize that it's real and do what's best we can to stop the spread.
I know that's right. Lady Nurse Barnes, final words.
Okay, well, my final thought is protect yourself, protect yourself, protect yourself. You are only really mainly responsible for yourself. We can't, because I was very concerned about the pastors I just saw this week where a pastor in California is holding his church with 6,000 to 7,000 people. That very few people are wearing masks, if any, and definitely no social distancing. It's church as usual. I think that is egregious on so many levels. It is wrong, and it is putting people in jeopardy recklessly. And I do believe that we have esteemed pastors on such a high level, you know, until we don't even use our common sense a lot of times, you know, as it relates to that. But we have to be smart with our own health, because as I told somebody else, when you're dead, I'm sorry doesn't matter. You know, oh, I apologize. Right. You know, when half of your church is contracted and dying, I'm sorry just won't fix that. So we have to be smart for ourselves. We had, I remember, and I'll say this really quick, a pastor that was giving an interview, his drummer came up HIV positive. I mean, not HIV, COVID positive. And he said, well, don't put on social media. He said in the interview, he told him not to put it on social media that he was positive. Well, why not? If you had them coming to church and you believe that they wouldn't contract, now you're worried about your reputation. The first thing I would have done is put it on social media. You know, it's hypocritical, it's wrong, you know, and they want to put people in jeopardy and then not take responsibility for it, saying don't put it on social media. No, he should have put it on social media so that everybody else in that church would be warned. And so we just have to be smart for ourselves, think for ourselves, and protect ourselves. And that's my spiel on that.
Thank you so much, Lady Barnes. Nurse Barnes, we appreciate you. Thank you. Is Dr. V available? Dr. V, where are you?
Yes, sir. You know, I think one of the things that people need to do is really look thoroughly at information, look at several different sources before you come to a conclusion. And as everyone has said, protect yourself. But the most important thing in protecting yourself is getting your diet right and getting your system in line, getting your exercise, getting your vegetables, making sure that your immune system is as strong as it can be, and wear your mask. Personally, I have a P100 mask that I wear when I go to the grocery stores, the bus, you know, that sort of thing, because we know this virus is generally airborne. At least that's what they're saying right now. So that's the information I have. This is about the best thing that I can protect myself with from any type of airborne contaminant. So, you know, you need to protect yourself.
All right. Dr. V, I wasn't able to see you wearing a mask, so you got to take a picture of yourself in the mask, and you got to send it to me. I need to see that mask because it took everybody aback. Whatever this mask was, it took everybody aback. So I need you to send me a picture of you wearing that mask. Is Dr. Odili, is he still here, Dr. Odili?
Dr. Odili had to leave, but he left his information in the chat. He said that he would come back. He left information about his book, Coronavirus, My Mind Journey. And he addresses a lot of different myths in that book, and you could get it on Amazon also.
Oh, wow. Well, we'll go ahead and give us a final thought, Dr. Echols, and then after you, if our Sourceseeker have anything to say, but Rudy, I'm definitely gonna let them talk. He's hiding in the wings, everybody. The Sourceseeker is here, but Dr. Echols-Sampson, talk to us.
Thank you so much again, Bishop, for hosting, and Mr. Alexander for inviting me again. It's very rare that I have any free time since the pandemic. So I always enjoy coming on, giving my actual expertise, you know, in this area. And I just want the people to not only to be spiritually aware, but also to do things in a natural to take care of themselves. Like Dr. V was saying about taking your vitamin C, eating right, get your exercise in, really get proper sleep, you know, drink your 8 to 10 glasses of water a day. I've been working really hard to get people off of cigarettes, nicotine, things that is destroying their lungs. Vaping is not good for your lungs. Marijuana, smoke, any kind of smoke that goes in your lungs, it's not good, and you will not be able to fight off this virus. Cigars, drinking alcohol. The government declared liquor stores essential. That doesn't mean that you go and buy all the liquor in the liquor store and get drunk. are drinking excessively during this pandemic.
Yes.
People cut back is hurting your immune system, so that if something does come in your immune system, you're not strong enough to fight it off. And so I thank you for this platform. I believe that we're covered by the blood of Jesus.
Amen.
So we're coming out of this. And I decree and declare Psalm 91. No plague should come in our tent.
Hallelujah.
Jesus, amen.
Amen.
He that dwell in the secret place. Let me quit. On a personal note, Dr. Echols, I had the pleasure as a young man of meeting a doctor by the name of Dr. Benjamin Echols. You wouldn't be related to him, would you?
I know Dr. Echols, but I'm not related to Dr. Echols. Yes.
Yeah, Ben Echols. I met him. I saw your name. I said, that brought me in remembrance. Listen, all my guests, I want to give you a personal thank you. I have been enlightened and illuminated, and I'm going to take the information that I've learned from everyone on today, and I'm going to govern myself accordingly, and I'm asking the public to do the same thing. You got some good information, whether you agree with it or not. It's something you can use, but you can use. Take it and run with it. What you don't believe in, just put it on the shelf and keep taking in information. We're coming back for a part 2, and my guests will be back, and I want you to be back too. This has been great. This is just the beginning of it. I want to thank everyone for being a blessing to us, the community, and all those watching over the internet. From all of us here, this is the Sourceseeker Hour. I thank you. I'm Bishop George Sanders. Thank you for letting me be your host. To everyone, I want to say good night. Can't wait to see you on our next Sourceseeker Hour. Thank you so much.
Thank you.
Thank you. God bless everybody.
God bless you all. Bye-bye.